The fight against COVID-19 pandemic is far from over. As of today, 1,048 people have tested positive for the virus, bringing the total to 823,700 cases, with 19 people succumbing to the disease. What is worrying is as the disease continues to spread to the counties, the ability of healthcare facilities to provide critical services to the patients that need supplemental oxygen is to be questioned. Today's report by Kenya Medical Practitioners and Dentists Council on isolation centers show that most counties do not have the capacity to provide critical services to the COVID-19 cases. Looking at preparedness per county level, Nairobi, which is the most affected, has 2,661 isolation beds in all their healthcare facilities. At the same time, the number of ICU beds stands at 73 as of today. Nakuru has 172 isolation centers with only 10 numbers of ICU beds. Mombasa has 404 isolation beds with 16 ICU beds. Council of Governors, today led by their chairman Wycliffe Oparanya, however, says that it has been 3 months since the counties received equitable funds from the National Treasury, which has impacted on service delivery in the counties.
County governments have not been able to pay salaries, neither buy drugs, pay salaries for the workers, including our health workers who are tirelessly working to contain the spread of the virus, albeit in difficult circumstances. This has hindered effective general operations of the counties, including targeted responses to COVID-19 escalating cases.
He added that the government has not been able to pay salaries for all the workers, including healthcare workers who have been on the front line to contain the virus despite the challenges. They, however, are working on modalities to ensure the well-being of healthcare workers and their families.
County governments will designate well-equipped health facilities within the county to be utilized by health care workers and their families for treatment in the event that they contract the disease.
At the same time, he urged members of the public to exercise personal responsibility of observing the set guidelines by the Ministry of Health.
To enhance civic responsibility, all county governments will embark on a rigorous civic education campaign dubbed No Mask, No Service, Bila Parakoa Hakuna Huduma, beginning Monday, the 23rd November 2020. This will be conducted using all safe means available to pass and share the message, and including vernacular radio stations and other communication channels at the county levels.
In support of the healthcare workers, the Kenya Conference of Catholic Bishops have expressed their concerns on the lives of the healthcare workers following the deaths of doctors and are now asking the government to prioritize the facilitation of healthcare system in Kenya to prevent the loss of more lives. Mariana Mole for K24, Nairobi.